Welcome back to Your Dialysis Nurse, where we discuss everything kidney and dialysis related. So, I decided to give y'all weekly tips on dialysis topics, and today we will briefly discuss a patient who is cramping. Here's the scenario: your patient has been on the machine for a few hours now and has about 25 minutes left on treatment. They start to cramp in their legs and begin to stand to relieve them. What do you do? Now, this is not medical advice. Everything you do with your patients must be done following policy and procedures and per MD orders. I'm just simply sharing information that was shared with me by my preceptors and fellow coworkers years ago when I first started in this field. So let's get back to this scenario. Your patient is cramping. What do you do? A. Listen with the stethoscope. B. Call the MD over to assess. C. Allow the patient to stand to relieve the cramps and notify the RN immediately. D. Pause the UF and notify RN immediately. So let's go over all the answers it would not be and why. It would not be A. You would not listen with the stethoscope because it will not cause an immediate relief for the patient. Cramps are extremely painful for patients, so the first thing you want to do is help to relieve the pain. This would not accomplish the goal. It would not be B. You would not call the MD over to assess. Most of the time, the MD is not in the dialysis unit. They are in their office seeing patients, and most of the time, their office is not attached to the dialysis unit, meaning it may be like across town somewhere. Now, if the doctor happens to be in the dialysis unit at the time that the patient started cramping, they may walk over, they may not. They expect the nurse to handle the situation 99.9% of the time, and they may revisit the patient dry weight and adjust if needed. It would not be C. You would not allow the patient to stand during treatment. It can cause the patient to become very unstable and even cause cardiac distress. Patients are not allowed to stand at all during their treatment, which leaves us with the correct answer. D. You will call the nurse over immediately and pause the UF. Pausing the UF will stop the fluid removal for the treatment, okay? Saline will also help relieve the cramps for the patient. Thank you for tuning in to Your Dialysis Nurse weekly tips, and I hope this helps someone. If you have any questions, drop it in the comments below, and I will gladly answer. Your Dialysis Nurse.